Ladies and gentlemen, there are some real serious problems in rural America. Poverty is a problem, drugs, mass incarceration is now have hit rural America. There's a lot of crime, HIV is up, STDs are up. I did stories on how they're closing maternity wards in rural areas because there's hardly no one going there to have babies. So some of the hospitals are open, but they are closing the maternity wards. There's no need for it to be open anymore. And you have a large aging population there that really do need the hospital. And a lot of the young have left, the ones that could afford to leave, have left for the big cities and suburbs, moving closer to where work is. It's harder to be out in these remote areas now. Back in the day, it might have been a little easier for people to kind of go somewhere and isolate themselves. It's a lot more difficult now because, because the areas have so few people, folks, the government and people don't want to pour money into these areas anymore, not like they used to. So here's an article that came out yesterday in the Washington Post. Who's going to take care of these people as emergencies rise across rural America? A hospital fights for its life. So they're fighting hard to keep the hospital open. And it may not be a possibility, y'all. And that is a problem. What are you going to do with all these old people, and folks that have emergency situations that still live in these areas? So let's get into this story. And this is in Oklahoma, Fairfax. The hospital had already transferred out most of its patients and half its staff when the CEO called a meeting to take inventory of what was left. Employees crammed into Tina Steele's office at Fairfax Community Hospital, where the air conditioning was no longer working and the computer software had just been shut off for non-payment. I want to start with good news, Steele said, and she told them a food bank would make deliveries to the hospital and Dollar General would donate office supplies. So, how desperate are we? One employee asked. How much money do we have in the bank? Somewhere around $12,000 for a hospital. That is like a hospital, and that's all they got in the bank, $12,000. Ooh, that's not good. And how long will that last us? Under normal circumstances, she looked down at the chart on her desk and ran calculations in her head. Probably a few hours, she said, maybe a day at most. The staff had been fending off closure hour by hour for the past several months. Ever since debt for the 15-bed hospital surpassed $1 million. Yeah, that's easy for a hospital to accumulate that kind of debt. I mean, look at what you have to do on a regular basis. And it's outside ownership group entered into bankruptcy, beginning a crisis in Fairfax that is becoming familiar across much of rural America. More than 100 of the county's remote hospitals have gone broke and then closed in the past decade, turning some of the most impoverished parts of the United States into what experts now call health hazard zones. And Fairfax was on the verge of becoming the latest. The emergency room was down to its final four tanks of oxygen. The nursing staff was out of basic supplies such as snake bite, antivenom, and strep tests. Hospital employees had not received paychecks for the past 11 weeks and counting. Wow. 11 weeks without a paycheck? Damn. Woo, they're doing bad. Boy, you don't realize how bad it is until you see something like this. The only reason the hospital had been able to stay open at all was that about 30 employees continued to show up to work without pay, increasing their hours to fill empty shifts and essentially donating time to the hospital, understanding what was at stake. Some of them had been born or had given birth at Fairfax Community. Several others had been stabilized and treated at the emergency room after heart attacks or accidents. There was no other hospital within 30 miles of two-lane roads and prairie sprawlings, Osage County, which meant Fairfax Community was the only lifeline in a part of the country that increasingly needed rescuing. Yeah, well, it's really sad those people are in that situation. You know, y'all, I am not gonna lie to you. I have been through some of these rural communities, and I can honestly tell you, I would rather be in the hood. I would, if you seen how ran down, some of them are badly ran down. The houses, or you could just tell, they are just living in them houses. They're not taking care of them. And some of those houses are so badly ran down. Believe it or not, I if I had to choose the hood or some of these rural county areas, I would be in the hood. Seriously, I would be in the hood. Okay. If we aren't open, where do these people go? Asked a physician assistant, thinking about the dozens of patients he treated each month in the ER, including some in critical condition after drug overdoses, falls from horses, oil field disasters, or car crashes. Wow. So there where these people are, there's no other hospital for 30 miles. See, like I said, some people could handle that years ago, but I think that is going to become almost impossible. You're going to either have to consider moving, the population of people there moving closer, even if they want to remain in a rural area, maybe remain in a rural area, but move closer to where the hospital is. I don't know. I don't know, how do you stay in a remote area like that? This hospital more than likely is going to close. These people cannot work for free for the rest of their lives. And I don't even know how they're doing it now. 11 weeks with no paycheck. So I just don't know. These people are going to run the risk of dying if this hospital closes. It's very evident. Um, Dozens of patients he treated each month in the ER, including some in critical condition and drug overdoses, which we know are real prevalent in rural America. They'll go to the cemetery, another employee said. If we're not here, these people don't have time. They'll die along with this hospital. We have no supplies, Steele said. We have nothing. How much longer can we provide quality care? Wow. So this man in the picture, his name is James Graham, with 41 years as a primary care physician at this hospital. Wow. Longest serving member. 41 years working? Yeah. Yeah, because you know why he's doing that? Because they don't have no one else. It's not like they got a whole bunch of doctors stepping up to the plate to work in these remote areas. Doctors tend to want to be, in, bigger and more busier kind of hospitals where there's a lot of people coming and going. These little remote areas, you'll have a hard time hiring anybody or even getting people that want to work under those kind of conditions. They won't, you know? And these folks love to live in those remote areas, but I mean, just like this, look at what's happening. I mean, is it really worth it? Some people will probably still say yes, but I'm saying no. Now you got a life death situation in these rural areas as these hospitals are closing. Everyone in the room turned, as they often did, to the longest serving member of the hospital, James Graham, 67. He had worked as a primary care physician at Fairfax Community for 41 years, writing his cell phone number atop new prescriptions, making rounds while on dialysis through 2 kidney transplants, and sometimes hand delivering medication to indigent patients out the window of his pickup truck. Wow. For much of his career, he had been on call as the only doctor in town, where the need for medical care continued to rise. I mean, this man is clearly up in age. That's definitely not a good thing. Childhood poverty climbing up above 30%, accidental deaths doubling in the past decade, increasing rates of diabetes, heart disease, drug addiction, and obesity. Graham has been an honorary pallbearer at more than 160 of his patient funerals, watching the cemetery expand as Fairfax population decline from almost 2,000 to fewer than 1,300 through 40 years. Yeah, you don't even have a lot of people there. Wow. Yeah, and as people die, y'all, it's going to be fewer than that 1,300 left. The hospital remained the area's largest employer, and the town had sunk more than half of its annual budget into legal fees to file a lawsuit against the hospital's ownership company, hoping to retake control of Fairfax Community. There was still a chance the town could save the hospital in some form of partnering with a new management company if the bankruptcy court would allow it. Fairfax vice mayor had promised employees he would come by the end of the week to deliver an update and possibly even paychecks if new management could be found. Wow. Maybe we'll get good news, Graham told the staff, but we're holding out for a miracle. If some of you can't afford to keep waiting and working for free, you can walk away now and nobody will blame you. He looked around the room as his coworkers stood in place. A call came over the hospital's intercom. Medical assistant up front, a receptionist said. Graham waited for a second. Then the silence sounded to him like a decision. Okay, he says, moving towards the emergency room. Let's keep the doors open until someone tells us we can't. So these folks are working with no money and just helping the people in the community. That's what they're doing now. But this, ladies and gentlemen, is not a viable thing to do. You can't do this forever. You can't. Not unless some miracle come. I don't see how they're going to keep this small hospital open. Ooh, look at the hole in that person's leg. Oh, oh man. And look, you got the elderly. And the doctor himself is elderly. He's an elder. Wow. Okay. The hospital was the first building on the winding road into Fairfax, positioning atop the only hill in town for 65 years. It had served a county that was larger in the area, just a few US, it, you know, in the area than a few US states. So patients came from all over northern Oklahoma, traveling through cattle farms and across rolling prairies, sometimes driving up to an hour to reach the closed full service hospital. Wow. You got to drive over an hour? What if somebody's having a heart attack or stroke? You gotta go over an hour to a hospital? Do you know the danger in that? I guess they don't care. Wow. It was a single-story building about the size of an average elementary school. An American flag flew above the open door into the main lobby. Okay, and a small community is only as healthy as its hospital. That's very true. But the way I see it, y'all, these people are in trouble. I know it may not be possible to move everybody. Some people just don't have money, to move and relocate. That's why they are staying in these areas. They don't have nothing. In the past decade, emergency room visits to America's more than 2,000 rural hospital increased by more than 60%. Even as those hospitals began to collapse under doctor shortages and historically low operating margins, hospitals like Fairfax Community treat patients that are on average 6 years older. So their patients tend to be older people in these rural hospitals and 40% poorer than those in urban hospitals, which mean rural hospitals have suffered disproportionately from government cuts to Medicaid and Medicare reimbursement rates. They also treat a higher percentage of uninsured patients, resulting in unpaid bills and rising debt. A record 46% of rural hospitals lost money last year. Wow, that's a lot. More than 400 are classified by health officials as being at high risk of imminent failure. They're talking about the hospitals in rural areas. Wow. Hundreds more have cut services or turned over control to outside ownership groups in an attempt to starve off closure. Oh, wow. That's deep. Fairfax Community had survived a previous bankruptcy in 2011 and then passed through four outside ownership groups before being purchased in 2016 by Empower HMS, a Florida company that operated more than a dozen rural hospitals across the Midwest. The company promoted itself as a savior for struggling rural hospitals, but within months of taking over its in corporate office, had begun defaulting on some of Fairfax community bills and cutting its spending budget. Eventually, four of the company's hospitals had shut down, and nine more had entered bankruptcy, including Fairfax. it could no longer afford to provide x rays and CT scans. Wow. No more than remote monitoring for patients with irregular heartbeats. No more blood tests. So the hospital is opening, but man, it is like running on bare minimum things they can do. And now it came to Dr. Graham a day after the staff meeting, walking up to Steele in the hallway and waving another overdue bill. I hate to add another problem to your list, but this is a big one, he said, handing her a letter. It said his malpractice insurance was 3 months overdue. He had 15 days to pay a minimum of $1,000 on the balance, or he would lose his insurance and his legal right to practice medicine in Oklahoma. Wow. You know, what happens when this elderly doctor dies? They're going to be screwed at this hospital. Does it ever end? Steele asked. She looked at the letter and thought about the hospital's diminishing reserves in comparison to its mounting debts. $14,000 overdue lab test, $22,000 for leased machines, $9,000 to for the electrocardiogram readings, $70,000 owed to staff, companies, and more than $600,000 in overdue payroll. And remember, y'all, in the beginning of the story, they said all they got is $12,000 at the bank for this hospital. In the billing office, there was a stack of certified letters and at least one lawsuit from a vendor demanding its money. They don't have any money. I'm really no good to you without this, Graham said. So they're going to have to find a way to pay that. I mean, the doctor can't be without malpractice insurance. You might as well let me walk out and retire. I'll take care of it, Steele said. We can't do much without you. And she's right. Graham had been talking about retiring for a few years, but he was one of just two physicians at the hospital, and he didn't want to abandon his patients. He had tried recruiting his own replacement, but there was a doctor shortage of nearly 40,000 physicians across rural America. Those doctors don't want to be in those places. Number one, a facility that little is not going to pay a doctor that much. You got to think about that. And these doctors, they want to get paid. They want to get paid, y'all. And he couldn't find anyone willing to relocate to Fairfax. He tried mentoring promising students at Oklahoma medical schools, but they eventually chose to practice at bigger cities. See, that's what I'm saying, y'all. That's what I'm saying. You know, those little remote areas, they're not going to pay a doctor the money that they will make in a big city. And these young people coming out of college, medical school, they don't want them teeny salaries. That's not what they went to school for. Wow. He'd even tried submitting his resignation paperwork in 2018, selling his farm and moving 20 miles into the country with his wife. But his patients kept calling his cell phone, and there was no one else to treat them. So he continued returning to Fairfax to make rounds a few times each week. Wow, he can't even really retire. So he got to keep coming back and treating these people because there are no other doctors in the area for them. Now you understand why I said I would rather be in the hood than some of these rural areas. I'm telling you, and pull up the way some of these towns look, y'all. Some of them are badly ran down. It really is, you know, but it's up to them to care about that. But please tell me what you think. I will post the link to this article in the description box. This is really a shame, the situation they're in. In all honesty, this hospital is probably going to close. How do you keep a facility open and you can't pay the staff? And you got all these unpaid bills. And on top of that, you have patients that aren't paying any bills. And you can't keep this open. You really can't. But please tell me what you think, ladies and gentlemen. Please leave your comment and subscribe. Don't forget to hit on the notification bell. And I'll see you on the next video. Peace, family.